Welcome. The program will begin in 1 minute. You may begin, Allison.
Hi, everyone. Good afternoon. My name is Allison Hout. It is my honor to serve as the president of the League of Women Voters of Illinois. Thank you for being here and welcome to the Legislative Hour. The League of Women Voters of Illinois created the Legislative Hour to provide the opportunity for direct connection between League of Women Voters members and supporters and our representatives in the Illinois legislature. Today, we are pleased to welcome our esteemed guests from the House and the Senate, who will be giving us a firsthand look at their perspectives on important recent legislative accomplishments and sharing their insights into what these gains will mean moving forward as our state continues to strive for equity in healthcare, equity in the justice system, equity in access to the ballot.
Today, 4 legislators are joining us for an in-depth discussion of recently passed legislation representing priority issues for League members. We'll be recording the session and it will be available on the League's website. While our speakers are talking, we invite you to click on chat at the bottom of your screen and type in your own questions. People will be monitoring the chat. We're very sorry that Senator Lightford is feeling too ill to join us today. We're sending well wishes her way. We feel incredibly fortunate that 2 other leaders of the Black Caucus have agreed on very short notice to meet with us to discuss the omnibus bills that they shepherded through the system. For the first 20 minutes, we'll be joined by Illinois State Representative Camille Lilly from the 76th District, who will discuss the recently passed health care bill. Next, Senator Elgie Sims will discuss the criminal justice bill passed during the lame duck session. Then Senator Morrison and State Representative Katie Stewart will join us for a discussion of HB 1871, which brought some important changes to the election process. Welcome, Representative Lilly, and thank you so much for joining us today.
Thank you. Thank you.
Here's my first question. What are you proudest of in HB 158, the healthcare omnibus bill?
Thank you for having me. And I too, I'm sending prayers and well wishes to Senator Lightford, who helped shepherd us through this historical General Assembly that's going to really address some of the issues that are in our society around systematic racism. Our health pillar, which is our 4th and final pillar, is to make sure that everyone has access to health care, which impacts their quality of life here in Illinois. And what I'm most proud of is that we were able to work with members of the General Assembly on both sides of the aisle to talk about the importance of access to health care. And when we now were able to make sure that we are putting a hold on closing hospitals in our state, particularly during the pandemic, that was monumental. because many of the people who fell ill to the virus needed access to healthcare via the hospitals and the hospital settings. And those hospitals were closing in our state in the most vulnerable populations around the state, the poor, the Black and brown community. And to put a moratorium on closing hospital was monumental in our state, where we have said to health facilities, you cannot close and leave a void of access to healthcare to women and children and their families who are in much need. So I'm very proud of that piece of legislation, where we will put a moratorium while the pandemic is unfortunately in our country, in our world. They cannot close their doors.
So the bill was sent to the governor on April 2nd. Do you anticipate that he will sign it?
Yes, as a matter of fact, I was on the phone with his capable staff on this day, and we have set a date to sign the bill within the next week. So we are excited to be a part of that bill signing, and it'll be the final bill signing of the 4 pillars of the Illinois Legislative Black Caucus.
Do you anticipate any problems with funding the provisions of the bill?
Well, a good portion of the bill, we had to, in order to pass it, actually, we had to say it's subject to appropriations. And what we are waiting on through this and many of the other tentacles of our state is our revenues for this coming year, and making sure that we have the resources to support the much needed components of our society. In addition, we're getting a 1.7 billion coming from the CARES Act, and we've already received billions as well. So when we looked at this bill, Senator Hunter and I, we said, we're going to have resources to address the much needed needs to stop people from getting sick and stop people from dying from COVID. But we also know we have to reform healthcare, reform hospitals, reform managed care. We have to do a lot of reforming to really be successful in making sure people have access to healthcare. If you don't have your health, you don't have much else. So we're optimistic that we are going to, what I call, when we're talking about transformation and reform, we're transforming the mindset of the administrators, of the government, of what healthcare really means to people, and that it is a right. It is a right that you can gain access when you're under the weather or you're sick. It's humane, actually. So we want to make sure that in this transformation and these reforms, that includes the budget. So we're excited about subject to appropriation, but that conversation is on the table as we move forward. And I'm very excited about the conversations around community healthcare workers, around the doula program, around access to substance abuse and mental health. I'm excited about those conversations, and we're going to move forward to make sure those things happen.
And of course, relying on the CARES Act gives funding for this year, but not future years. So we're going to need to continue to advocate for funding in the future, I'm sure. So the League is particularly pleased that the bill includes some provisions that are consistent with our positions, like the prescription monitoring program and no tax on blood sugar testing materials, funding of safety net hospitals, child care assistance. Could you speak a little bit more about those to tell us exactly what is HB 158 doing for these issues?
We have worked with dozens of providers, advocates over the past 7 months to talk about these much needed basic services that people are needing, and how it is important, one, to fund them, but two, to improve access to them. And what we're doing with all of the prescriptions, all of the safety net hospitals, and all of the mental health services and from behavioral health to inpatient psych is making sure that they are priorities for funding. I'm very fortunate to be the APPROACH Human Service chair this session, and I get to talk and advocate on behalf of this bill and many of the priorities that you have mentioned of the Women's Voters League to make sure that those resources are funded. And I'm going to say that we meet every week at 7 o'clock in the morning to discuss where and how much where these services are going to be located and how much we need to fund them at. So that's what it means. It means that we are be funding much needed services and coordinating them and integrating them into a community health wellness model. So diabetes is a major issue in the poor and Black and brown communities. We want to make sure that that they have a primary care doctor to help them manage that particular illness. So we want to make sure the community health workers are there to help those families navigate that much needed care. And we also are making sure that the doctors understand the communication and the importance of communication with their patients, making sure that they have a continuum of care that allows them to be well and have quality of life. So it means a lot. The input that you all have provided has really focused us on where we need to be prioritizing healthcare and healthcare access.
We appreciate that. One of the parts of the bill that is particularly of interest is the racial impact provision, which goes beyond healthcare. Could you talk a bit about that one? I think this is a powerful part of the bill.
Thank you. This particular piece of legislation I've carried, and this is an omnibus bill. So let me say this real quickly. A good number of the components of this bill, many people have been working on for decades. And what we have done, we have placed all of those health needs and health concerns and health opportunities to into this one omnibus bill. And the racial impact note is a bill that I carried, I believe, in either the 99th or 100th General Assembly, where it is emphasizing the importance of creating policies and legislation that doesn't have an adverse impact on a minority population, poor, Black, brown communities. And what it does, it allows us to pause and evaluate the impact of a particular bill on racial issues. And when we do so, it stops us from making policy that harms people. We did over 8 subject matter hearings, and we met with advocates, the academias, and what we learned was every piece from the academia, every piece of legislation that we produce in our state, in our country, has an impact on health and wellness. Not a percentage, not half. Every single piece of policy that we create in our state and in our country impacts your health. And with that fact, it is important that we have a racial impact note because the most vulnerable populations are being impacted without that lens. This is a lens of equity, and it's a lens of rights, where you have a right to healthcare. Many of the basic essentials that you may have in your community or in your family, not every family has that. And the basics is education, jobs, housing, transportation, food, healthcare. Not every community or every household has access to those basic essentials. This racial impact note looks at that to make sure there's create a void to any of those basic essentials. We're not the first state to do this. We are following a lot of the lead of Wisconsin and Michigan. So with that, we're looking to institute, I would say, a process that keeps us focused on making sure our communities and our families are well. and have access to health care.
We appreciate that. And now issue specialist Janet Kraft will be posing some of the questions that have been asked in the chat section. And I encourage people to submit their questions for Representative Lilly.
Representative Lilly,
Yes.
here's the first question. Since HB 158 has not yet been signed, I guess by the governor, or funded, what hospitals have closed due to financial or other challenges?
We've had a couple hospital closed, but in recent news, we're actually reopening them. Westlake Community Hospital in Melrose Park closed. There was a Far South, Mercy Hospital was planning to close, but and on the brinks of closing, but it has not. And there was one other one that closed that has not been reopened. I can't think of the name, but with the policies that Speaker Welch has put in place, I believe that hospital will be able to reopen as well. And then there was some hospital, as I heard, it's about 2 to 3 hospitals who were planning to close during the pandemic. And we are looking to work with those hospitals and those administrators to make sure that they understand the importance of their institution, and 2, how we can work collectively to keep those doors open so people could gain access to healthcare, much needed healthcare.
And she asked, what will be the cost of implementing this bill? And how many Republicans voted for it?
The cost is, I'm going to say different components have different cost factors. And as I mentioned earlier, the bill was subject to appropriation. And when we look at the community health worker, that may be a larger ticket item for us to do, but it's a much needed one because it does gain access and navigation of state and local healthcare access. So that can be well into the hundreds of millions of dollars. However, we are looking at the budgets now. We're looking at the CARE Act. We're looking at the shifting resources where they're most needed so that we can get the health outcomes that we desire here in Illinois. Some of our dollars are just in the wrong place. It's funding things that are not a priority. And it is, how can I put it? It's imperative for us to look at those things and talk through those items, those line items, and make sure that everyone, there's nobody having an adverse effect on change, but also we all are supportive towards our priorities. So I'm excited to be a part of those discussions. We have every discussion we've had with the Republicans at the table. And they really believe that the community health workers, for example, is a much needed component to our healthcare delivery system. We just have to figure out how to fund it, and they're supportive of that. We've had, what I know, in the Senate, we have 1 Republican that I can recall voted for it. So we call that a bipartisan piece of legislation. But in the House, many of the Republicans came up to me and appreciated us putting this legislation forward and looking forward to making sure that we're doing better for the people of Illinois. So I'm going to say it is bipartisan.
Okay, thank you. Just one other, there is a current bill, I'm losing it here, I think it's 1590, that would, from the department, it would allow the Department of Insurance to regulate fees, costs of drugs. And that sounds like it would be positive as far as costs go.
when we talk about regulating, I love those conversations. Not everyone is excited about them. So I think it's a beginning.
Yeah, well, we'll see how it goes. but
Yes,
Thank you so much.
you're welcome.
So again, thank you so much for agreeing to meet with us today, Representative Lilly. You're welcome to stay with us. We understand you have another commitment, but we truly appreciate your stepping in at the last minute.
You are welcome. Thank you for the invitation, and please feel free to invite me back. I love to talk about what you would like us to talk about. So have a blessed evening, and thank you.
Thank you. And now welcome Senator Sims. Thank you for agreeing to meet with us today as well. I really appreciate your stepping in at the last minute.
My pleasure. It's Leader Lightford has done a tremendous job, and she's been a mentor of mine for a long time. So being able to step into her stead is it's an honor for me. But it's more of an honor for me to talk to League of Women Voters because of the tremendous work that you do to advocate for all of our communities. So thank you for having me.
Thank you. So please share with us what you consider to be some of the highlights of HB 3653. You were instrumental in shepherding this through the Senate.
Yes, ma'am. Well, thank you. The House Bill 3653, which we call the Safety Act, and Safety Act stands for safety in our communities, accountability for law enforcement, and fairness and equity in our criminal justice system, happening today. It's one of the most pro-safety, pro-reform piece of legislation that we have ever seen in this country. I love having the opportunity to talk about some of the things that you've heard about the Safety Act, because there's a lot of mis and disinformation going on. But what the Safety Act really does is it modernizes Illinois sentencing laws. It moves us away from the policies focused only on incarceration as a way of dealing with public safety to one that deals with trying to address underlying problems and challenges. One of the areas that has received a number of issues and a lot of attention is the end of the cash bail system. Replacing our cash bail system with a system that detains dangerous individuals based on their threat to public safety or their flight risk, not their ability to pay. An individual's the size of someone's bank account should not determine whether or not they're held in custody on a pretrial basis. Their threat to public safety or their failure to appear threat, those should be taken into consideration, and the reform of the cash bail system does that. But it also institutes a certification and decertification system statewide for police officers. Prior to the passage of the Safety Act, a law enforcement officer could only be decertified from law enforcement activities upon conviction of a crime. Now there are underlying conditions that would allow for an officer to be decertified prior to conviction. That's a huge change. But there's also the requirement that in the Safety Act that allows for and requires the use of body cameras statewide by 2025, starting with large municipalities and municipalities or counties of 1 million or more, starting in 2022, out to smaller municipalities and the state police out in 2025. So municipalities of 50,000 or less. There's also reforms that that are crowd control response reforms. So changing the way that law enforcement officers interact with crowds who are exercising their First Amendment rights, but also amplifying and reforming training standards for law enforcement officers. We want to give law enforcement officers the opportunity to have the best training possible. We want to be able to lift them up and demonstrate that the training is giving them the training tools to be successful, because we want to improve the profession of policing, and by reforming and amplifying training standards, we can do that. We also, the Safety Act also prevents the destruction of law enforcement misconduct records. Then prior to this year, there was recently a Supreme Court decision that allowed for that said that law enforcement misconduct records could not be destroyed. So we wanted to make sure that we codified that Supreme Court decision and built that into the Safety Act. But also creating what's called co-responder models. And these co-responder models allow for the connection of substance abuse treatment and mental health treatment connections with first responder duties. That's critically important because if we know that law enforcement officers respond to a number of cases, but what if we gave the opportunity to allow for other professionals to also be involved in these discussions and these interactions, increasing and improving de-escalation and mental health training for law enforcement. Again, giving law enforcement officers the tools to be successful in improving the professional policing. Requiring that police develop a plan for children and other vulnerable populations in the execution of search warrants. Also empowering the Attorney General to investigate deaths occurring in police custody, addressing officer wellness and mental health awareness and screenings, banning the use of chokeholds, establishing statewide use of force standards by 2022, ending the practice of prison gerrymandering, allowing for law enforcement officers to have a duty to intervene, but also then to have whistleblower protections for officers. As I mentioned, this is one of the most comprehensive pieces of legislation in the country and in Illinois' history. And I can't thank my colleagues enough who stood with us as we passed this legislation, as we looked at reimagining what public safety really looks like in this state. And that's what the passage of the Safety Act was all about. We have tried the policies of mass incarceration. We've tried the policies that don't invest in addressing underlying conditions. What if we reimagine public safety and started to really address those underlying issues, so that we could have a system of public safety that gives everyone the same opportunities, no matter what your zip code is and no matter what you look like. So I'm so proud of not just the members of the Illinois Legislative Black Caucus who sponsored this legislation, but the members of other caucuses, members of the Downstate Caucus, members of the Latino Caucus, members of the Progressive Caucus, members of the Women's Caucus. This was really a broad-based effort to reimagine public safety in the state. And I am so proud of my colleagues for the work that we were able to accomplish by passing the Safety Act.
I think when you listed all of the provisions of the bill, people really get an idea of what it means to be an omnibus bill.
Yes.
It's huge. And, unfortunately, it went beyond current league positions. So we weren't able to support it, but we sure were on the sidelines cheering for it. In the meantime, we did just complete a study of the criminal justice system, and people spent a lot of time and effort on studying it. And so we will be able to update our position for the future. But one issue that we kept encountering in the study was the need for financial support. So do you anticipate that the 2022 budget will provide funding to realize the promises in the bill? Should we be anticipating needing to advocate for that?
Absolutely. And I will be remiss if I did not thank Governor Pritzker, in addition to signing the Safety Act, putting not only the gubernatorial pen behind the policies, but also investing in the resources necessary to make the Safety Act not just a vision, but a reality. And so the budget includes, as I mentioned, the requirements for body cameras. There is about $2 million. In my previous work, when I was in the House, I was served as a House Judiciary Criminal Committee chairman. And at that time, I passed with then State Senator and now Attorney General Kwame Raoul the state's protocols for body cameras. Well, in that law, we created a body worn camera grant fund. There's about $2 million in that fund, and in addition, the governor put $3 million in the 2022 budget to fund body cameras as it relates to the Safety Act. But then there are also other investments that were made, investments in training. That you find there's about over $10 million in the Illinois Law Enforcement Trainings and Standards Board's budget request for fiscal 22 that speaks to those increased training protocols that I talked about. So yes, there's a number of investments made in the fiscal 2022 budget that we would certainly love to have your help in advocating for. because they're necessary to as we talk about making those improvements in public safety and reimagining what it looks like.
So do you anticipate that it'll be an uphill battle to implement parts of the bill, given the strength of the police union and other opposition forces?
Well, that's why I'm so glad to be able to do forums like this, to talk about the reality of what the Safety Act does and what it doesn't do. You know, you hear oftentimes, as I mentioned in my opening comments, the mis and disinformation campaigns. I've heard everything from the Safety Act defunds police, and the Safety Act does, the Safety Act changes this, and the Safety Act changes that. When you read the text of the law, you realize that the Safety Act doesn't do any of those things. And we just mentioned additional investments in resources for law enforcement officers. So you can't be defunding law enforcement officers and cutting and investing in them at the same time. That's antithetical to reality. So that just doesn't happen. But having individuals push back on that mis and disinformation is critical. We created a website, and I'll drop it in the chat for anybody who needs it. It is hb3653.org, and it includes everything. I said that in another instance that about the website, and it includes text, the full text of the law, but it also includes a detailed analysis of the law. It includes testimonials from victims, from crime survivors and victim advocates, etc., about how the Safety Act will change public safety in this state. So while I know there's a tremendous amount of pushback, the conversations that we're having will combat that. And specifically to the changes for cash bail, we have the reason we will see it, in my opinion, a very different experience as we remove cash bail from the system in Illinois versus some of the other states who've tried it, is because we've put this 2-year runway into place. So the cash bail elimination doesn't go into effect until 2023.
Oh.
So that allows us to partner with, and that was specifically requested by the courts, so that they could pull together all courts from across the state to train them on the new risk assessment tool that's being used by the courts, to train them on the protocols and the policies that courts and judges will have to follow as they make those decisions about whether or not someone is held on a pretrial basis or whether or not they're released on a pretrial basis. So we gave that additional time for the court to work and help establish that. So while there are a number of folks who are still trying to walk back the Safety Act, there are more of us who are trying to move forward and have progress in this state.
I think another advantage perhaps of extending that is, I know that there are some municipalities that, especially downstate, that really depend on cash bail for funding things, and they're going to need to figure out a transition to another system for how they can fund their needs.
Absolutely, and as I say, having those discussions, and we've had discussions since the passage of the Safety Act with county board members, with local elected officials and mayors and police chiefs and sheriffs and county clerks, because we want this to be change. When change happens, it happens not just because you put the policy in place. It happens because we change our mentality, we change our focus, and that's really what the Safety Act's all about. It's about changing. I get mentioned, we've tried mass incarceration, we've tried the policies of the past. Now it's time to try something different. You know, doing the same thing over and over again and expecting a different result is the very definition of insanity. So we've seen what the policies of the past have gotten us. Now it's time to try the policies of the future.
That's great. Now, issue specialist Janet Kitlas is going to be asking questions that are submitted through the chat. And may I remind people to do indeed submit your questions for Senator Sims.
Senator Sims, thank you for your good work.
Thank you, Janet. How are you?
I'm great. One question that I had was that some people will think there might be more electronic monitoring when cash bail is abolished. Are there safeguards against that?
That's a great question. As we talked about, that reimagining what public safety looks like, we're not just trying to change from one policy to another, but really focusing on those underlying causes. And I'm glad Leader Lilly was on before me. I know she probably talked a little bit about some of the pillars. And that's really what the having that holistic approach to the pillars was all about. Addressing those underlying policy changes that get to those root causes. So we've been talking for a long time about reforming our electronic monitoring process and policies and procedures. And because we did not just want there to be a default where you automatically just sent individuals automatically to electronic home monitoring, because that has there's a whole nother connotation to that. And you have another subset. And Jen, I could talk for hours about these topics, but there's a whole nother subset of individuals who end up in the Department of Corrections after they've been arrested on these technical violations. The technical violations could be a violation of electronic monitoring. So there are a number of reforms that we're focusing on, and we did not, and that's why that 2-year time frame was so important, because we didn't just want this default to electronic monitoring as a substitute for making real decisions about whether or not a person is a threat to public safety or a threat to fail to appear. So electronic monitoring cannot be the default position that just takes over those decisions. We want to make sure that individuals understand and are making these real decisions about whether or not a person is a threat to public safety.
Yes, thank you. Another question is, someone wanted to know, what is prison gerrymandering?
Absolutely. So under current, prior to passage of the Safety Act, when legislative districts are drawn, when monies from the federal state government are apportioned, they are done based on the number of people who live in a locality. Individuals who are incarcerated within the Department of Corrections, Illinois Department of Corrections, are counted where they are housed, or where they are incarcerated, as opposed to where they live. The vast majority of the state's nearly 20,000, there are more than 28,000 people housed in the Illinois Department of Corrections facilities around the state of Illinois. The vast majority of them will return back to the communities where they live, because they have sentences of 5 years or less. So they'll return back to their homes, but they will be but prior to the passage of the Safety Act, they will be counted where they were incarcerated at the time of the census. Under the Safety Act, the Department of Corrections, in partnership with the Secretary of State's office, has to count that individual where they lived and at their last known address, as opposed to where they were incarcerated. So we have a more full picture of where an individual comes from, as opposed to where they were incarcerated.
Thank you. Another question is, how can the Safety Act be held up as best practices legislation for other states to follow to counter the unfortunate label, defund the police?
Great question. Because it is so comprehensive, and it is so all encompassing. It has been held up for other states, and there are a number of states who I just told one of my colleagues in Pennsylvania just took the Pretrial Fairness Act portion, the cash bail elimination portion, and introduced it in Pennsylvania. So we are talking to colleagues from around the country. We've had conversations with members of various legislative organizations talking about how the Safety Act makes improvements and what that means, and having them use that as a model, and it's specifically to counter that narrative that, well, you can, and I say this all the time. You can support good officers and want to improve the profession of policing at the same time. They are not mutually exclusive. So that is, I'm so glad that the questioner asked that. Donna asked that question, because that is exactly what we're trying to do, making sure that we make those investments that will improve the policing profession.
Well, it's always good to see Illinois being a trailblazer for other states.
Absolutely, Jenny. That's always our goal. We always want to lead the way in the good things.
I have one more question. How was juvenile justice, or is juvenile justice addressed in the bill, including sentencing and charging kids as adults?
Well, we made significant changes to charging juveniles as adults prior to passage of the Safety Act. The Safety Act focused on the adult system, but we have continued to have discussions with representatives of the juvenile justice system, but also the governor and his administration about changes we could make to addressing those underlying challenges. And again, that's when I come back to the holistic approach that we took to passing those 4 pillars, because we've gotten so used to passing policies and passing law at the end of failures in all these other areas, whether it be education or economics or healthcare. When we failed in all those other areas, then we'll pass a policy in the criminal justice system to pass these harsher sentences, thinking that somehow that's going to address the failures in those other areas. We've got to start asking basic questions. How is this happening? Why is this happening? And that's why we wanted to have that 4-pillared strategy to address failures in education and shortcomings in economic opportunities and healthcare disparities in deserts, so that we can have these policies that would allow us to move forward. That's why I'm so proud of the work that not only the Black Caucus did, but I'm so proud of the work of the Democratic caucuses and those other caucuses, Downstate Caucus, Women's Caucus, Latino Caucus, all those individuals who stood up and said, we want to invest in these areas because we know it will improve the quality of Illinois.
Thank you so much.
Thank you so much, Janet. Appreciate it.
So thank you again, Senator Sims, for joining us today. We truly appreciate the breadth of your understanding of this, the clarity with which you described it, and your willingness to step in at the last minute.
No, it was my pleasure. I thank you all for having me. It was an honor and privilege to be here.
So you're welcome to stay with us. We're going to be talking about the election processes bill 1871 that just made it through. But we understand you're a busy man, and we appreciate the time you gave us.
No, I appreciate it, and I see my good friend Leader Morrison, and I'm gonna step off the stage and let her and Representative Stewart have the stage and go get my COVID test. So it's good seeing everybody. So the League was pleased at how quickly HB 1871 made it through the General Assembly and was signed into law by the governor immediately before the April 6th election. And joining us today are the bill's sponsors, State Senator Julie Morrison and State Majority Caucus Whip, who is the Senate Majority Caucus Whip of the 29th District, and State Representative Katie Stewart of the 112th District. What are the major provisions of the bill? I'll let you guys decide who will answer that one.
I'll start. Is that okay?
That's fine. Go ahead.
Okay. Good to see you, Katie.
Good to see you.
This bill has three main provisions. It allowed for drop boxes that election authorities could use. It allows for curbside voting for people who might have difficulty getting in and out of a car and getting in and out of a polling place. And it requires that every ballot returned would be delivered regardless of whether or not it had sufficient postage. And this was legislation that it did pass quickly, you're right, but we had taken this up in the spring or earlier rather, and we're able to pass it in the Senate. The House had a lot of other business going on and they were not able to react as quickly as we did, So I'm delighted that our colleagues in the House were able to get it across the finish line.
It has some very important provisions. Representative Stewart, did you want to add anything to that?
Sure. Yeah, I just wanted to, it was building on for the 2020 general election. We had made some kind of, you might call them like emergency or kind of stopgap provisions. And we realized that there were some that we should, at this point in time, we're not done talking about changes to our elections by any means, but there were just these few things that we should, put in place and make permanent at this time. So that's where the impetus of it came from.
So we understand that some other bills have not advanced this session. For instance, leading to permanent vote by mail lists or declaring the general election day a state holiday or pre-registration of 16-year-olds in ranked choice voting. The League is hoping that HB 1871 opens the door to these other changes. Do you know of efforts that would lead to these or other reforms in election policy?
If it's okay, Senator Morrison, I can speak to that first.
Sure.
I was actually just on a call today talking about these issues. So there is the will, at least in our chamber, and I think there is on the other side of the hallway. Many of those issues, the option to maybe opt in to put yourself on a permanent vote by mail list if you so choose. I know that the work on early registration has been going on for years, and I know that they're still discussing it. And so I think we could be looking at some type of kind of a package of maybe a few of those reforms. I can't make any promises, but conversations are still happening.
So you think before the end of the session?
There's a possibility, yes.
Senator Morrison, what are you hearing?
Very much the same, that we did see some of the important changes go into place right away, but there are a lot of people who would like to be on a permanent vote by mail list now. And the 16-year-olds and 17-year-olds who were judges did a great job and really filled in for some of our older judges who were not comfortable being in the polling place yet. And what a great way to engage young people in the election process. I'm hoping that those young men and women want to continue to stay engaged and to run for office themselves and see their names on the ballots at some point. There is also a group of individuals who are working on for people who have assistive technology in their homes.
Yeah.
And that would be especially for people who are blind, to figure out a way to allow them to actually download and vote in the privacy of their own homes with these assistive devices, with their computers, would give them the ultimate privacy. We're still working out how that works, the operations of it, and then how that would either be sent electronically or would it actually be printed off and put in an envelope and mailed, just like, any other ballot. And then there's an interest in a bill in the Senate to even further expand early voting hours and times. We saw in this last election in 20 that a third of the ballots were cast early, a third were cast by mail, and a third were election day. So our voting pattern is changing. The trends are significant. And I think we need to make sure our law is evolving with the way people want to and can vote.
Absolutely. And now Barb Layman's an issue specialist for election laws is joining us to pose some of the questions that have been submitted. And once again, I invite people to insert their questions in the chat.
So a major thought on many leaguers' minds right now is there any possibility that the primary election next year can be postponed so that redistricting can take place in a way that will not be rushed by constraints on filing petitions that people need to do for the 2022 primary? Representative Stewart, did you want to go first?
Sure. I mean, I'm at a location because we're having a redistricting hearing that starts in about 10 minutes. So that's where I'm actually zooming in from. Statutorily, we're required, right, to pass our map by a given date. So, that's going to happen on that timeline. There is no talk of moving the primary, at least that I've been a part of.
Senator Morrison?
I would echo the same thing. I know it's kind of out there. I haven't heard any serious discussion about doing it yet.
Thank you. Can you possibly share with us the tenor of the conversations and discussions that are taking place in each of your chambers regarding ranked choice voting? Yeah, are there any discussions going on, considerations being made?
I'll go first.
Sure.
We aren't.
Yeah.
I'm not hearing any conversation about it. Not that it's not an important issue, and the league has brought it up, but I would tell you right now, this week is a deadline to get all bills that originate in the Senate passed out of the Senate over to the House, and the House has the same deadline for the bills that originate there. Between a kind of a truncated session and working remotely, I mean, this might be considered a part of this omnibus election bill that I do think we're going to see later in the spring, but not as a standalone bill.
Yeah, I would echo that. If we see anything on it, it would be part of the omnibus package. I'm aware of all the work that's been done on it. I used to teach a course that had a section all about different methods of voting and voting theory. And I get the benefits of the ranked choice voting, especially in a lot of municipal elections for sure. So I'm anxious to continue those conversations. I just don't know that we'll get to that point of figuring it out by the end of this spring.
We have another question just about elections in general. Is it possible, is there any way possible for the local elections to be consolidated as both a cost savings and to increase voter turnout?
I mean, anything can be changed, I guess, right? I know that there's advantages to bringing everybody to the polling place on one day. I think there's also advantages to having two separate. I think you engage a whole new group of people. There are people who will vote in a local election that won't bother with a national or a federal one, and vice versa. So again, might be theoretically, it might have a lot of benefits. I don't think you're going to see anything like that this spring.
Yeah, I would say that, especially in a presidential year, all the oxygen in the room all really does get sucked up in that presidential race. And the local issues, I mean, if you have a school bond referendum or, your local mayor, I just worry that the people wouldn't be able to put the attention on those races. And I'm afraid we'd have even more kind of down ballot drop off in terms of people not voting the full ballot. So, I'm not saying it's not a moot point. It's not that it'll never be discussed. But that's a longer term conversation, I think, than this legislative session.
Will both of you be sponsoring or co-sponsoring the omnibus bill? That's a possibility for this spring?
Yes.
The league has developed a list of priorities that I think both of you have received earlier this year. We'd be glad to resend those. One of the concerns that we have is conformity throughout the state in election practices and procedures. Has there been any discussions regarding the fact that drop boxes are allowed but not required, and that different counties have different procedures for vote by mail, et cetera?
I think the uniformity is there's lots of different ways. I like to have local control to some degree, because every community is different. The suburbs operate very differently than a very rural community. For example, when you talk about drop boxes, the one area I really want to see uniformity on is the development of an envelope that the vote by mail ballot is returned in. There was a lot of confusion. Well, where do I sign? How much postage? There was, and I think this is something that will be developed so that everybody across the state uses the same universal ballot envelope for the return.
Yeah.
So there's some things that are really important.
Yeah, I would agree too. I think there was such an emphasis on vote by mail and so many people that did it for the first time. And there was some confusion when people got multiple mailings to their home with different looking forms. And I talked about this just today, that I think we could go towards, if the league or, the young Republicans on a college campus or somebody wanted to do a drive to get people to vote by mail, make it that they have to use the form that's available on the Board of Elections website, that they can't, generate their own unique looking form just for consistency purposes, to change confusion. It was also, we talked about, if depending on the county that you were in, when you tried to kind of follow your ballots process, if you use vote by mail, where you found that information, the wording that was used, whether if it says accepted, does that just mean it got delivered, or does that mean that the signature's been checked and it's all good to go? So clarifying that language and trying to make that consistent across the state, I think is a good step that we can pretty easily take.
That would make a lot of leaguers very happy. Thank you. Another concern that several leaguers have is there a way to include a candidate's email address on a required field for the state nominating petitions in this omnibus bill? It would make contacting candidates in advance of an election so much more efficient for voter forums or for future constituents to reach out to them.
I haven't looked at that yet, honestly.
I have not either, but I'm not disagreeing. It's not a bad idea. That's something that Senator Morris and I can maybe talk about.
So Barb, you want that on the nominating petition itself?
Yes, when they turn, you turn in your address and everything is certified. If they could put that on the nominating petition, it really saves a lot of time and effort searching out candidates for their participation in our voter education, for us and other groups as well. Do you see the possibility of the pre-registration for 16-year-olds being included in the omnibus bill?
I've asked for it to be, so I'm hopeful that it will make it to any final omnibus bill.
Well, thank you both so much. We will be in contact with you.
Please do. We really
Yes.
rely on the league because you guys have been at this a long time. You've looked at lots of variations of progress. So please reach out to us this spring.
We're excited to hear this news this afternoon. And thank you so much for taking the time. And I'll turn the meeting back to Jean.
Thank you.
I'm not seeing any other questions in the chat box. So we truly appreciate Senator Sim and Morrison and Representative Lillian Stewart joining us today. And we thank all of the concerned audience members who joined us and contributed questions. Please join us next week at 10 a.m. on April 26th for our lobby day. We'll be advocating for environmental, criminal justice, and education bills. Thank you again to both of you. Truly appreciate your work and support of fair and open elections.
Thank you very much.
Thank you.